He says politicians wanted to end the practice in hospitals and other facilities a decade ago, but they haven't acted. He wants those methods outlawed immediately after a patient died at a specialist unit in Lismore.
Miriam Merton, drugged, in pain, alone. Head injuries from 20 separate falls would claim her life. This footage of neglect would outrage the country. Mentally ill and locked in isolation for hours, a practice that New South Wales promised to phase out in 2005.
The tragedy of Australian mental health is not that politicians can't agree. The failure has always been in the follow-through, the implementation.
Professor Hickey says the problem could be solved tomorrow.
Not another decade, not another inquiry, not another actual human rights investigation, but a simple, straightforward set of actions.
Restraint and seclusion, techniques to control a patient's behaviour, have become rarer in our hospitals. Cases of seclusion have dropped by nearly 30% in 7 years. That's in line with promises to reduce the practice, but far short of aspirations to eliminate it. The man leading the internal investigation into Miss Merton's death says he's unhappy with the speed of change, but will not rush things.
We need to remember that we're dealing with some of the most vulnerable people in our community, and it's very easy in the pursuit of one sort of change to create a different kind of harm.
Change will come too late for the mother of two, but may protect others from facing such traumatic treatment. There's consensus among the political and medical voices that the future of New South Wales healthcare contains limited role for practices such as seclusion and restraint. The question now is how quickly that reduction can be accomplished. At the centre sit some of the state's most vulnerable and how we as a community choose to treat them. Richard Martin, ABC News, Sydney.